Peace, mercy, and blessings of God be upon you. Welcome, my friends, to a new episode. And as usual, we'll take a small, practical medical case together. A real-life question that almost every pharmacist or doctor hears again and again. Today's topic is very simple, but extremely important because it's one of those cases that happen every single day in the pharmacy or the clinic. We'll talk today about a patient who has hypothyroidism, meaning his thyroid gland is underactive. He's already seeing his doctor and is taking his regular treatment, the well-known medication Eltroxin, also sometimes written as Levothyroxine or Eltroxin. The patient has been on this medicine for a while, but one day he comes into the pharmacy or clinic and says something many of you have probably heard before. He says, "Doctor, I'm going for my thyroid blood test today. Should I stop my medication before the test? My friend told me I have to stop for a day or two for the results to be accurate." Then maybe he adds, "If I take my pill today before breakfast, how long should I wait before doing the blood test? 10 minutes? Half an hour? A few hours?" And maybe his final question is, "I started my treatment only 2 or 3 weeks ago. Can I go test now to see if it's working?" These 3 questions may seem small, but they're very important. And answering them correctly helps the patient avoid confusion, wasted time, and wrong results. So today together, we'll take this case step by step, calmly, clearly, and with real understanding. Understanding the thyroid gland. Before we answer the questions, let's recall some basics. The thyroid gland is a small, butterfly-shaped gland located in the front of your neck. It may be small, but has a major job. It controls your body's metabolism, the rate at which your body turns food into energy. It does this by releasing 2 main hormones, T4 thyroxine, which contains 4 iodine atoms, T3 triiodothyronine, which is the active form inside your tissues. But how does your thyroid know when and how much to release? That's where the TSH hormone enters. TSH stands for thyroid-stimulating hormone, and it's made by the brain, specifically the pituitary gland. TSH acts like a messenger. It travels through the blood, reaches the thyroid, and tells it, "Hey, it's time to produce more thyroid hormones." If your thyroid is working fine, the system stays balanced. But if the thyroid is slow or overactive, the TSH changes. It goes up if your thyroid is underactive, and goes down if your thyroid is overactive. That's why TSH is the main test doctors use to monitor thyroid function. It's very sensitive, meaning even small changes in thyroid hormone levels will cause TSH to rise or fall. Hypothyroidism, in simple words. Now, in hypothyroidism, which means low thyroid activity, the gland doesn't produce enough T4 and T3. When that happens, the brain senses a shortage and increases TSH levels to try to push the thyroid to work harder. But sometimes the thyroid just can't respond properly. For example, because of autoimmune diseases like Hashimoto's thyroiditis, where the immune system mistakenly attacks the thyroid itself. So TSH rises, but the gland stays weak. That's why blood tests show high TSH and low thyroid hormones in hypothyroidism. The treatment, of course, is Eltroxin, which is a synthetic version of the natural T4 hormone. It replaces what your body can't make, helping you return to normal metabolism, normal energy, and normal body functions. Why do we need regular testing? Now, because thyroid hormones are so sensitive to changes, the dose has to be adjusted carefully, not too high, not too low. That's why regular blood tests are essential. But here's where many patients get confused about when and how to do those tests correctly. So let's solve that confusion today. Question 1. Should I stop my levothyroxine before testing? The answer is no, absolutely not. You should never stop your thyroid medication before your blood test unless your doctor specifically tells you to, which is extremely rare. Stopping it can cause a sudden drop in hormone levels and give a completely wrong reading. The test results would no longer reflect your usual stable condition. They reflect a temporary disturbance from skipping your medication. The American Thyroid Association, ATA, and UpToDate both confirm this clearly. Patients should continue taking their usual morning levothyroxine dose unless their clinician specifies otherwise. So, you can reassure your patients or yourself that there's no need to stop taking your medication, before your lab test. Question 2. What's the right time to do the blood test after taking the dose? This is a very important question. We all know that levothyroxine should be taken early in the morning, on an empty stomach, about 30 to 60 minutes before breakfast, with water, and you shouldn't mix it with coffee, milk, or supplements right away because they affect absorption. But when it comes to blood test timing, many people don't realize that testing at different times can give slightly different results. Here's why. After you swallow the pill, it takes a few hours to be digested, absorbed, and released into your bloodstream. The peak blood concentration usually happens about 2 to 4 hours after taking it, and then it slowly decreases over the day. So if you test right after taking your pill, say 1 hour later, the levels of free T4 may look higher than usual. That's why experts recommend that blood tests for thyroid follow-up be done at the same time of day each time, and typically 8 to 10 hours after the last dose for consistent results. In practice, that means if you take your pill at 8 in the morning, the best time for your test will be around 4 to 6 p.m. Some laboratories test patients early in the morning before they take their daily pill. That's also fine. What's important is consistency. Always do your tests under the same conditions so that your doctor can accurately compare results over time. Question 3. When can I check after starting or changing my dose? This is another key question many patients ask. When you start taking levothyroxine, or when your doctor changes your dose, your body doesn't adjust immediately. It takes weeks for your TSH and hormone levels to reach a new steady state. How long exactly? Because the half-life of the T4 hormone, meaning the time it takes for half the dose to leave your system, is about 7 days. The body needs about 6 weeks, sometimes a little more, to reach a stable level. That's why doctors usually test thyroid function 6 to 8 weeks after changing the dose. Testing earlier than that won't show the true effect because the hormone levels are still adjusting. So remember this clear rule. After you start or change your thyroid medication, wait 6 weeks before doing follow-up lab tests. Signs, symptoms, and why the gland may swell. Now that we've handled the blood test timing, let's talk about something else that often causes confusion. Thyroid swelling or an enlarged neck area, which you may see as a visible or palpable goiter. Many people immediately think that swelling means hypothyroidism, excessive thyroid activity, but that's not always true. Swelling can happen in both overactive and underactive thyroid cases. Here's the reason. When the pituitary gland produces a lot of TSH to stimulate a weak thyroid, that extra stimulation can make the tissue grow larger, just like a muscle trying to work harder. So, an enlarged thyroid doesn't automatically mean hypothyroidism. You must always confirm by lab tests, mainly TSH and free T4, before assuming anything. Sometimes a gland enlarges because of iodine deficiency, autoimmune disease, or benign nodules, non-cancerous lumps that are very common. So again, the appearance alone can't diagnose the condition. The blood work is the real key. How doctors evaluate thyroid health. Now, what happens when a patient visits a doctor for thyroid assessment? Let's understand the diagnostic process step by step, so that if you're a pharmacist or even a curious patient, you can follow what's going on. Step 1, patient history and symptoms. The evaluation always starts with symptoms. The doctor will ask, do you feel unusually tired or lazy? Have you noticed weight changes? Are you feeling cold when others aren't? Is your skin dry, your hair falling out, or your voice hoarse? Or on the contrary, do you feel too hot, anxious, or your heart races? These questions help the doctor suspect if it's a hypo or hyper problem even before testing. Step 2, blood tests. Then comes the lab work. The first and most important test, as we said, is TSH. If the TSH is high, that usually means the thyroid is underactive. If it's low, the thyroid may be overactive. Sometimes, the doctor will also check free T4 and free T3 to confirm. Step 3, check for antibodies. Because many thyroid problems are autoimmune, the doctor may request tests for thyroid antibodies, such as anti-TPO, thyroid peroxidase antibody, anti-TG, thyroglobulin antibody. These results help identify Hashimoto's thyroiditis, the most common cause of hypothyroidism, or opposite antibodies like TSI, thyroid-stimulating immunoglobulin. In Graves' disease, which causes hypothyroidism. Step 4. Imaging tests if needed. If there's a visible swelling or nodules, the doctor might order ultrasound imaging of the thyroid. This shows the size, shape, and any lumps or cysts. Radiologists often use a scoring system called TIRADS, Thyroid Imaging Reporting and Data System, with categories from 1 to 5 that estimate the likelihood of cancer. Most nodules are harmless and need only regular follow-up. Only a small percentage require biopsy, when a thin needle is used to take a small tissue sample for testing. So, in most cases, there's no need for panic. Regular follow-up and communication with the doctor are enough. Normal lab numbers and what they mean. Now, let's talk about the numbers themselves. For most adults, the normal reference range of TSH is around 0.4 to 4.4 μ/L. Some labs go up to 5. But numbers can vary with age, pregnancy, and test methods. For example, during pregnancy, the doctor may want the TSH to stay a little lower because pregnancy needs slightly higher thyroid hormone activity for the baby's growth and brain development. So remember, only your doctor can interpret your results correctly according to your situation. Don't panic if your number doesn't fall exactly in the middle of the range. What if you have hypothyroidism and it's not controlled? If the thyroid hormone levels remain low and TSH stays high, it means you probably need a higher dose of levothyroxine, but slowly and carefully, under medical supervision. Common signs that your treatment isn't adequate include persistent fatigue or mental fog, feeling cold most of the time, weight gain without increased eating, slow heart rate, thinning hair and dry skin, irregular menstrual cycles, depression or low mood. On the other hand, taking more than you need can cause the opposite symptoms: nervousness, fast heartbeat, tremors, or even bone loss over long periods. That's why you should never adjust your dose by yourself, and always follow your doctor's instructions, checking your blood tests regularly. Key rules for taking L-thyroxine correctly. Let's pause for a second to go over the golden rules of taking this medicine properly, because so many small mistakes can affect absorption and blood test results. 1. Take your pill on an empty stomach, ideally 30 to 60 minutes before breakfast. 2. Use plain water only, no coffee, milk, or juice with it. 3. Wait at least 4 hours before taking calcium or iron supplements, antacids, or multivitamins. 4. Take it at the same time every day for consistency. 5. Do not change your brand or formulation without consulting your doctor. Even small changes can affect hormone levels. 6. If you miss a dose, don't double it the next day. Just take your normal dose the following morning. These simple habits make a huge difference in how well your treatment works and how accurate your blood tests will be. How long to wait after a dose change? Now, let's revisit the concept we mentioned earlier, the steady state. When you start any new dose, your body gradually builds up to a stable concentration of the medicine in your blood. This happens after about 6 half-lives of the drug. Since levothyroxine's half-life is around 7 days, 7 days times 6 is equal to 42 days, roughly 6 weeks. That's why doctors don't test you immediately after changing the dose, because before 6 weeks, your hormone levels are still shifting and won't show the full effect. So if your doctor increases your dose today, don't rush to test after a week or 2. Wait a month and a half, then test, and you'll get a meaningful result your doctor can trust. Summary of the 3 most common questions. Let's quickly recap the 3 main questions from our case today. Question 1. Should I stop my levothyroxine before doing the analysis? No, don't stop. Continue as usual unless your doctor clearly says otherwise. Question 2. When should I take the blood test after my dose? Ideally 8 to 10 hours after taking your pill, or consistently at the same time each visit, using the same lab conditions. Question 3. When can I test after starting or changing my dose? After 6 weeks, about 1.5 months, because that's how long the medicine takes to reach steady levels in your body. Important notes about autoimmune thyroid diseases. Just one more point for clear understanding. Many thyroid problems are autoimmune, meaning your body's own immune system mistakenly attacks the thyroid gland. In Hashimoto's thyroiditis, the immune system gradually destroys thyroid cells, leading to hypothyroidism. In Graves' disease, it does the opposite. It overstimulates a gland, causing hyperthyroidism. These conditions can appear at any age, more frequently in women, and often run in families. Regular testing is key to early detection because symptoms may appear slowly. Want to see a doctor immediately. If you already take thyroid medication but still experience unusual symptoms, like severe fatigue, swelling the neck, chest palpitations, or sudden mood changes, don't wait. Go back to your doctor. Also, if you're pregnant or planning pregnancy, your thyroid must be well controlled because low thyroid hormone can affect fetal development. In such cases, doctors usually monitor blood tests every 4 to 6 weeks during early pregnancy. The takeaway. So, my friends, if you're living with hypothyroidism, remember this is a very manageable condition. With consistent medication, correct testing, and regular doctor visits, you can live completely normal, healthy, energetic days. Don't get misled by myths or random advice. Don't stop your medication without a reason. And don't rush to test before the right time. Patience and timing make your results more accurate and your treatment more effective. Today, we answered the 3 major questions you'll face as a pharmacist or as a patient dealing with hypothyroidism. 1. Continue your medication before the test. 2. Time your blood test properly after your dose. 3. Wait 6 weeks before retesting after any dose change. Follow these steps, and your thyroid numbers will always make sense to your doctor, helping you adjust treatment precisely. Thank you, my friends, for staying with me until the end. If you found today's video helpful, don't forget to like, share, and subscribe to the channel, and comment below your questions. Maybe your question will be the next case we discuss. Till next time, wishing you health, peace, and energy every day. See you soon.